بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله تعالى وبركاته. Our lecture today about stomach and duodenum. Stomach is the most dilated part of the gastrointestinal tract. It is G-shaped structure. Their function to store the food and regulate their passage into duodenum. The stomach, their shape differ according to the body status. In the obese people, where the thoracic cavity is narrow, the stomach is located in the upper part of the abdomen, while in very thin people, the abdominal cavity here is narrow and the stomach may reach to the pelvis. In most population, the position of the stomach, as you know, the abdomen is divided into 9 regions: epigastric, umbilical, hypogastric, right and left, hypochondrium, right and left lumbar. Here, the stomach located in epigastric, left hypochondrium, and umbilical region. The stomach has 4 parts. In some reference, 3 parts. Cardia surrounded the cardiac orifice. Fundus, body, pylorus. We need demarcation between these parts. Here, there is a notch. This border of the stomach known as lesser curvature, and this border known as greater curvature. So the left border is lesser curvature, while the right and greater border is greater curvature. Here, there is a notch known as cardiac notch. Draw line from the cardiac notch to the greater curvature. Above this line, this is a fundus. And also there is a notch here known as angular notch. Draw line from angular notch to the greater curvature. Between these 2 lines, here is the body of the stomach. Distal to this line is pylorus. Again, the upper part here known as the fundus. The middle part is the body. The distal part is pylorus. The pylorus is divided into 3 regions. The dilated part of pylorus is pyloric antrum. Distal to it is the pyloric canal. The terminal part that joins the duodenum is pyloric orifice. The stomach so has 3 parts: fundus, body, pylorus, and has 2 surfaces: anterior surface and posterior surface. Has 2 borders: lesser curvature and greater curvature. Lesser curvature Lesser curvature is the left border. Greater curvature is the greater and right border. The lesser curvature provide attachment for lesser omentum that connect the liver to the stomach. The greater curvature provide attachment to the greater omentum. This greater omentum has 4 layers, 2 anterior layer and 2 posterior layer. The 2 anterior layer with the 2 posterior layer join each other below the level of transverse colon. This greater omentum attached to the anterior border of the pancreas. The stomach has 2 orifices, cardiac orifice and pyloric orifice. The cardiac orifice joins the esophagus and pyloric orifice joins the duodenum. So, the stomach is a D-shaped structure responsible for store the food and regulate their passage into the duodenum. It has 2 borders, greater and lesser curvature, that provide attachment for lesser and greater omentum respectively. It has 2 surfaces, anterior surface and posterior surface. The anterior surface related to the anterior abdominal wall, liver, to the anterior abdominal wall, diaphragm. The posterior surface related to the many structures that form the stomach pit. These structures are transverse colon, transverse mesocolon, pancreas, splenic artery, left kidney, left suprarenal gland, and left crus of the diaphragm. All these structures form the stomach pit. Again, the structure forms the stomach pit: diaphragm, left suprarenal gland, left kidney, splenic artery, spleen, pancreas, transverse colon, and transverse mesocolon. Blood supply of the stomach. The blood stomach is intraperitoneal organ, so it's completely covered by peritoneum except where the blood vessel enters the stomach. The blood vessels run along the lesser and greater curvature. The arteries run in the greater curvature are left and right gastric arteries. The arteries run along the greater curvature are right and left gastro-omental or gastroepiploic artery. Okay, the left, so the blood supply of the stomach by 5 arteries. Left gastric artery branch from the celiac trunk. Right gastric artery is the branch from hepatic artery. Left gastroepiploic artery branch from the splenic artery. Short gastric artery, which supplies the fundus, also branch from the splenic artery. Right gastroepiploic artery is the branch from hepatic artery through the gastroduodenal artery. venous drain of the stomach by the right and left gastric vein corresponding to the arteries. Right and left gastric vein terminate into the portal vein. Short gastric and left gastromental or left gastroepiploic terminate into the splenic. Right gastroepiploic terminate into superior mesenteric vein. Lymphatic drain. The lymphatic drain terminate into the gastric vein, gastroomental vein, and then corresponds the artery and then pass through the efferent vessels, accompany the vein, and terminate into celiac lymph node. Innervation. Innervation, the stomach supplied by autonomic nervous system, sympathetic and parasympathetic. The sympathetic innervation from the greater splanchnic nerve from T6 to T9. Parasympathetic are branched from the vagus nerve. I have a question for you. What is the role of the sympathetic and parasympathetic for motility and sphincter? And also I have another question here. What are differences between physiological sphincter and anatomical sphincter? And give example for each. Okay, try to answer these two questions. Okay, now move to the duodenum. Duodenum is a part of small intestine. The small intestine has three parts: duodenum, jejunum, and ileum. Duodenum is different from the jejunum and ileum because it is the widest, fixed, and the shortest part of the small intestine. It differs from the jejunum and ileum. The duodenum is the shortest, widest, and fixed part, and also is the retroperitoneal part. Retroperitoneum means covered by peritoneum anteriorly. This duodenum forms C shape around the head of the pancreas. Duodenum is the secondary retroperitoneum organ, means secondary retroperitoneum. That means actually it was intraperitoneum and then converted to retroperitoneum. Describe that later in the development. This duodenum extends from the first thoracic vertebra to the third thoracic vertebra. It has, as you see here, from first thoracic vertebra to the third thoracic vertebra. It has three parts. More simply, first part, second part, third part, and fourth part. Also, we can divide the duodenum into superior part, descending part, horizontal part, and ascending part. The first part about 2 inches, the third part, the second part is about 3 inches, the fourth part 3 inches, and the fourth part 1 inch. The first part of the duodenum is related posteriorly to the portal triad, is related to the hepatic artery, bile duct, posterior to it, portal vein. All this structure rests on the inferior vena cava. This first part, about 2 inch. The first inch is intraperitoneal, and when you use contrast, the first part appear as a cap, so it is named duodenal cap. The first part anteriorly related to the liver. The second part or descending part extend from the first lumbar vertebra to the third lumbar vertebra. Is related posteriorly to the hilum of the kidney. Hilum means the entrance of the structure, when the structure enter or leave the kidney. Here, posteriorly is related to the hilum of the kidney. Anteriorly is related to the transfer column, related to the gallbladder. Laterally is related to the ascending colon and kidney. Medially is related to the head of the pancreas. In the second part of duodenum, there is the 2 papillae, major duodenal papilla and minor duodenal papilla. Major duodenal papilla is formed by hepatopancreatic duct, while the minor duodenal papilla is formed by accessory pancreatic duct. All here, the major duodenal papilla and minor duodenal papilla located in the posterior medial part. The third part or transverse part located at the level of L3, and it crosses the left psoas major, inferior abdomen, inferior vena cava, abdominal aorta. And is related anteriorly to the coils of the small intestine. The ascending part, it ascends again to the level of L2 and join the duodenum to form duodenal flexure. This duodenal flexure is fixed in position by muscle or known as suspensory muscle or ligamentum teres. This ligamentum teres, when contract, it widens this flexure and allows the foot to move to the duodenum. Blood supply of the duodenum. Duodenum is developed from the foregut and midgut, so is supplied by branches from the celiac and superior mesenteric artery. Their branch from the celiac, it gives the celiac trunk, give hepatic artery, and this hepatic artery give rise to pancreatic duodenal artery, to the gastroduodenal artery. This from the gastroduodenal artery originates superior pancreatic duodenal artery. The superior mesenteric artery is the artery of the midgut. It gives rise to the inferior pancreatic duodenal artery. So, the blood supply of the duodenum by superior and inferior pancreatico-duodenal artery, which are branches from the celiac and superior mesenteric arteries respectively. Venous drain by pancreatico-duodenal veins. These pancreatico-duodenal veins terminate into superior mesenteric vein. The venous drain into pyloric vein and pancreatico-duodenal vein, which accompanies the arteries to the efferent lymphatic vessel, accompanies the arteries to terminate into celiac lymph node. As you see here, this part of stomach projects through the hiatus hernia, projects through the thoracic cavity, through the diaphragm to form hernia. So one part of the stomach project into the thoracic cavity, and the cardia fixed in position. This is known as paraesophageal hiatus hernia. When the cardia and part of the diaphragm projects through the thoracic cavity, known as sliding hernia. This hernia more common in the middle age due to the weakness of muscular part of the diaphragm and widening of the esophageal opening of diaphragm. At duodenal flexure left to it, there is recess known as paraduodenal recess. When the part of the intestine located here form paraduodenal hernia. During repair of hernia, take care for the branches of the inferior mesenteric vessels. Gastric ulcer means lesion in the mucosal membrane of the stomach. When the lesion in the pylorus or duodenum is known as peptic ulcer. Peptic ulcer and gastric ulcer most associated with H. pylori infection. When the ulcer in the duodenum, the most common site is the first part of the duodenum, and when the ulcer penetrates deep the wall, the most common site in the first part of the posterior wall of duodenum. When the ulcer penetrates deep into the wall of the duodenum, it may perforate the wall of the duodenum and also penetrate the artery. The most common artery here to be penetrated is gastroduodenal artery, and this leads to peritonitis and bleeding. قال رسول الله صلى الله عليه وسلم: حسب ابن آدم لقيمات يقبن صلبه. Okay, thank you very much. Good luck.